Woodbury County and the surrounding areas saw one of the first hotspots in COVID-19 cases in the tri-state area between April and June, and healthcare workers were faced with many unknowns.
In part 2 of our 6-part series, we look at how the surge impacted our local hospitals and changed how Unity Point Health and Mercy One staff their facilities.
We had 10 days between when we had 10 patients and when we had 45 patients.
Hospitalizations in Woodbury County rose rapidly in late April to early May. Mercy One Siouxland and Unity Point Health St. Luke's halted elective surgeries and transformed areas into specialized COVID-19 care centers.
Within the hospital, we diverted all our resources towards managing COVID-19, towards early detection, isolation of these patients, getting them to appropriate units and then treating them.
Inpatients surged beyond initial staffing capacity.
And during the surge, places from different units would go help, as so the ICU, which normally in this hospital, pre-COVID, saw about an average of 12 patients a day, and we were up to in the 20s during the COVID surge, and so there just aren't enough ICU staff to manage all those patients, and so we had nurses and techs and people from other areas going to help in those areas that have increased capacity.
Staff from across the state stepped up to help.
We had staff from Waterloo and Cedar Rapids and Des Moines come and help. We actually had ventilators from our sister hospitals in those cities also. They shipped to us to help with our surge.
The hospital closed to visitors and COVID units closed to everyone but the critical care team.
During the surge, for those key areas like the ICU and for a med surge area as well, we closed them and what we call dedicated the unit to COVID patients. It was really to protect staff and to conserve personal protective equipment.
For Dr. Behera, the surge was like nothing he had ever experienced.
It was like different world altogether. Those were restricted areas, felt almost like a war zone with everybody wearing the PPEs like they're aliens and almost like out of a movie.
Physically, the staff was exhausted. I think administratively, people were mentally exhausted. So you felt physically tired because there was so much that you had to do and so much that was going on.
Week after week, hospitalizations decreased into late summer, but once again, cases are starting to climb in September.
We got as low as 2 patients in St. Luke's in terms of inpatients with COVID. That was mid-August. Now we've crept back up. We're in that 10 to 12 to 15. We just kind of ebb and flow in there.
Healthcare professionals are using what they learned in the spring to prepare for the fall.
We have put together a plan where we have extra staffing in place if we have to call them in. Our COVID-19 units that we had in place earlier that have been dismantled because our numbers have gone down are ready to be up and running any moment. Most importantly, we have reserves of PPEs that we need because I think those are very important in an uptick of these numbers. So I think we are well prepared for the winter.
This fall, the World Health Organization says a surge of cases is expected worldwide, and hospitals in Siouxland are preparing in hopes to weather the storm for a second time.
And we've been trying to get back to normal and at the same time trying to prepare for a second wave of patients. We're starting to see numbers pick up now, and so the things that we're doing to prepare, we're trying to get those things in place as fast as possible.
If you missed any of our stories this week, you can find them at the top of our website, SiouxlandNews.com, and tune in tomorrow for part 3, where we explore how patient care has changed in the age of COVID-19.